Jamaica now has its first heart hospital at the Heart Institute of the Caribbean, HIC, in St. Andrew, which is dedicated to improving the outcome for patients with cardiovascular disease in Jamaica and the Caribbean region. During a visit to the institution that has been transformed into a hospital solely responsible for cardiac care on Balmoral Avenue recently, the Jamaica Observer was given a tour of the facility by HIC's founder and Chief Executive Officer Ernest Madu. The 24-bed institution features a 24-hour cardiac ambulance service, an emergency room equipped with crash carts and defibrillators, state-of-the-art electrocardiogram machines the size of cell phones, password-protected electronic medical records, which allow for cooperation between doctors when documents are logged and reviewed by senior consultants from anywhere in the world, centrally monitored systems and specialized labs to include echocardiogram lab, nuclear cardiology lab, a catheterisation lab, a coronary care unit, a cardiac intensive care unit, and an operating theatre. Other features of the cardiac hospital include tilt-table testing, one of 3 such machines in Jamaica used to check fainting disorders, a vascular profile machine, the only one in Jamaica, a transoesophageal echocardiogram machine used to get a magnified view of the heart to see if there are infections, tears, or other complications, coronary angiograms and angioplasty, an electrophysiology system, exercise stress echocardiogram, carotid and vascular ultrasound, and pulmonary function tests. The actual building which houses the hospital is designed with medical-grade floors for clinical practice, has antimicrobial walls, an air quality unit which has 15 air exchanges per hour, and in the operating theatre 25 air exchanges per hour. Patients are centrally monitored through a computerized system at the nurse's station. The walls and roofing are air and watertight, and the operating theatre has UV lights that sanitize the area. Additionally, patient rooms have a nurse call button, single oxygen systems and beds that can calculate body weight, plus central music systems. Another feature of the operating theatre is its waste anesthetic gas disposal system to protect against cognitive impairment of physicians during surgery, and a camera operating in real time that allows surgeons across the world to assist during procedures. With this, you realize care could be more optimal than you hoped for. Doing this, we realized it was the right move. The patients were asking for it for years, as when we send them elsewhere they don't always get the type of care we think they deserve, he explained. Further, Dr. Douglas Waldo, a team member at HIC, said the time was ripe for a full-fledged cardiac hospital in Jamaica. When I came to HIC many years ago, we did training from the ground up. I had done a lot of mission work, but I came with an unrealistic idea of what I could do for the people of Kingston and Jamaica. We had to train nurses who didn't have the same background as what we expected from cardiac nurses, and it was not their fault. Now we have the capability. You usually hear that the number 2 cause of death is cancer, but what's the number 1? Heart disease.